Ma'am, what would be your relationship advice?
In relationship, what I feel is the first thing that you want is,
How were you able to maintain that kind of trust in that relationship?
that doubt about the trust can be there in a relationship.
In today's world, cheating on your partner and extramarital affairs, this has become very common in medical fields and everything.
That kind of extramarital affairs are there. We should accept that.
Especially long distance relationships are a good choice in the medical field. Why did you choose biochemistry as a career option?
Biochemistry is a subject which is not directly dealing with the patient, but it is a subject with clinical touch.
What are the career growth paths after doing MD Biochemistry?
There are multiple options after taking MD Biochemistry.
Which one do you think has the best potential in the upcoming 10 years?
And I will say,
Happy Valentine's Day to all. Today we are doing a very new aspect of the Nachiket Bhatia Show. And we have mixed the subject that we have always hated, biochemistry. I can still sense shivers when I think about Krebs cycle. Man, that chart, that everything still scares the shit out of me. But I have got the faculty, the educator, the doctor who has made biochemistry simple for people all over the world. People say that her name and biochemistry goes hand in hand. She's an associate professor in the Government College Calicut. She has written the book Everybody in the Medical World Stands By the Self-Assessment and Review of Biochemistry. And I think by now you know the name, you know the legend, you know Dr. Rebecca James. So Dr. Rebecca James today is going to help us decide what biochemistry is all about, what are the career opportunities, and she is giving out some love secrets of her own. How her relationship made her the person who she is today, and what every medico should know about love. Everything in just an hour. That's what today's show is about. Let's welcome Dr. Rebecca James. Welcome, Dr. Rebecca ma'am, to our show.
thank you, Dr. Nachiket. I'm more privileged than you to be in your show. Thank you so much.
Thank you so much, ma'am, for your kind words. So, before we begin on to your journey, I would like to know everything about Dr. Rebecca James. How did you start? Where did you grow up? What was your childhood, teenage years, and the MBBS days? How were those days?
So I am a village girl, was born in a small town in central Kerala. My father was a banker, so I have to do my schooling in different schools in Kerala. So that was about my schooling. And if you ask me why I choose MBBS, before when I was in elementary school and primary school, basically I want to be a lawyer. So after I reached high school, that passion has faded off. Then most I was one of the toppers in all the schools I studied. So most of the toppers are going either to engineering field or medical field, and maths was not my subject. So definitely, I my choice was limited only to medical career. And then I could get a decent rank in UG entrance exam, and that's how I joined medical college. It was a government medical college in Kerala. That's where I joined.
Which one was it, ma'am?
First, I joined in government medical college, Kottayam.
Okay. One
Yes.
of the best in Kerala, and I would say in the country itself.
Yeah, of course.
I've been to that college. The students are just amazing.
Yeah.
Ma'am, the biggest question would be that why did you choose biochemistry as a career option?
I think that is the most important question that everybody is asking me, why biochemistry? So basically, when I joined medical college, I like to learn every subject in that matter. But first year was a bit difficult for me. But after that, I could get the crux of all the subjects in medical career, and I'm one of the best students in the class. Also, first after my first year, I was not at all that good. Second year onwards, I got into the track, and I was very best in almost every subjects except for a few subjects. Then that time itself, whenever I was very passionate about teaching, and whenever my teachers give me a topic for symposium, then I would like rock in that, because everybody likes my class. Then, once I started my internship, I had to directly deal with the patients. Then I understood that directly dealing with my patients is not my way. Because whenever a patient cry, that is affecting my mental status. I go into depression. I have all sorts of sleepless nights, insomnia, so many things. So I know that if I choose such a subject as my medical profession, then definitely I am not going to succeed. It's going to affect my personal life, that I definitely felt that time. So that is why my branch is not something which is directly dealing with patients. That was, I'm pretty sure about it. Then the question is why I took biochemistry. So I was shortlisted only to pre and paraclinical subjects. So among the paraclinical subject, my favorite subject, you don't believe, it's pathology. Then why I don't choose pathology? Because I was never good in looking into the microscopes. Because I can't identify anything by looking into the microscope, because I had a phobia for microscope. I don't know whether there is any such phobia existing, but for me definitely such a phobia is existing. So pathology is not my option. Then going to the first year subject, when I was a student as a PG aspirant, then one of my teachers in biochemistry is Dr. Parvati. She was like inspired me to take biochemistry. I had a personal encounter also with her because I had to work in palliative medicine for some time. So I talked with her, and that's how I took biochemistry, because I have seen her working in the research lab, dealing with the patients. And next thing which why I choose biochemistry is because biochemistry is a subject which is not directly dealing with the patient, but it is a subject with clinical touch. So that is why I took biochemistry. I got inspired by Dr. Parvati Varia.
That's great, ma'am.
Yes.
Ma'am, I would want to know the reaction when, for the first time in your first year, you entered into the biochemistry department. Like, as for all the medical students, when we enter into the first year, we are super scared of the anatomy HOD.
Yes.
He's like the god there, the boss man. Okay, the don that is coming there. There are these rumors that if you miss the anatomy HOD class, so you will get a supply.
Mhm.
Then there's
Yes.
the physiology department. Then there's the biochemistry
Yeah.
department. And we are least scared of the biochemistry department because half of the people are not even able to understand what is happening there. Now, did you, for the first time when you entered into that department, did you ever think that this can be the profession that you might be choosing for your life?
Never. Never. I never thought that I'll take biochemistry because I failed in biochemistry in the first internal and the second internal. I passed only in physiology. And anatomy also was not very scaring for me. First internal exam. Second internal also I picked up in physiology, and then biochemistry also I picked up. And in the final internal only I could clear anat, physio, and biochemistry. That's the truth.
What's your favorite memory in your first year days? Any special memory that you would like to share?
Yeah, definitely. My love story. That is the first thing that I should say. I told na I got admission in Government Medical College,
Hmm.
Kottayam first. Then I studied there only for 2 months actually. Okay. Then what happened is in the newspaper, a news came that 5 students are being transferred to various colleges in Kerala. So I was actually very near, Kottayam was very near my home. I was a day scholar over there. Then what happened is that news I have to join another college, which is Government Medical College Kannur, which is 300 kilometers away from home. So that was actually the what you say, the most difficult phase in my life, that I have to take admission next day, the very next day. So that day, the last day in Government Medical College Kottayam, after my dissection, when this news came, two hearts actually shattered. One was, of course, mine. The other was the boy who was always looking at me. I was not aware of that. I was not aware of that. And he came with a rose and a card to me. you know what will I do that day? I have to leave. I have to go to another college 300 kilometers away. So what should I do? I definitely, naturally, I throw it away just like in a movie, and I went away from that. But this boy was not ready to leave me. So he wrote a letter. That was the time there was no mobile phones, nothing. Only land phone was there. So he wrote letter to me after, I think around after 2 months. No, in the new college, what happened? Nothing. All the topics that was taken in Kottayam has been already covered there. Totally haphazard topics were all haphazard. So I was like very lonely, and I was like going back in my like learning process also. So that time that was one of the weakest moment in my life. And when I came back from from the new college one day, there was a letter on my table with in my name, and that was the letter from this boy. So he was not ready to leave me. He constantly started writing letter to me, and I told you I was in my weakest time at that time. And then I said, I thought around 1 or 2 weeks I have to think about this, and then I wrote a letter back to him. So I think that is the most what do you say, remembered moment in my life in my first year, that love story. Yeah.
And how did that love story continued?
Yeah. Then he is studying in Kottayam. I'm studying 300 kilometers away. So it was a long distance relationship for the next 6 months. I'm sorry, 6 years. Then we used to meet at my house is near Kottayam, no. So whenever I came home, I used to meet him in railway stations. So all those were our meeting points, and that's how we kept our relationship very strong. We had struggles, we had quarrels also in between, but still we maintained that long distance relationship only with letters. And sometimes he used to call me in my land phone. There is a phone in the hostel. That's the only contact that we had during our MBBS days. So that is my love story. Yes.
That's like a very true and a passionate love story.
Yes.
But do you think normally, I've heard so many situationships, I would say, where, when a guy or girl basically gets a better branch after NEET PG, they tend to leave the other partner.
Hmm.
Okay, because the other partner could not qualify or could not get a good branch. Normally, I'm sure you must have seen in your life as well.
Mm.
So, do you think the relationships, especially long distance relationships, are possible in the medical field?
Yeah.
I mean, you are that 1%. I am not comparing anyone with you. But do you think that, I mean, you are a friend to so many students also. I'm sure people must be coming to you that they got their heart broken because of some reason.
Mm.
So, do you think that, especially long distance relationships, are a good choice in the medical field?
I am not saying commenting on the word that whether it's a choice or not, but I always feel that if you can have that long distance relationship maintained for the 6 years or 5 or 6 years, especially in a medical career, then definitely you are together in your difficult phase. So any relationship which is active and which is very close to each other in your difficult phases is the one which lasts long. So if we are just attracted by external beauty and all, I don't think that relationship will last long. That is one thing I feel. And regarding the branch that you are taking and your love relationship, I don't think that you don't have to think about that branch in the case of relationship. Whatever branch you choose, what I feel is that the branch that you choose should not be based on your partner's choice also. It's your heart. You have to ask yourself and you have to decide on your branch. So there should not be any interference from your partner, not your parents, not your in-laws in the matter of choosing any branch. So definitely it has nothing to do with relationship. It's always your heart that speaks for you, the branch that you choose. So that is what I feel, that none of the branches or none of or in that matter should not affect your relationship, and long distance relationship is possible if what you have in between is nothing else, like not physical, not money, nothing else. If the heart to heart touch is there, it can be maintained. And I'm not saying that for everyone it is possible. So if it is not possible, means that partner is not yours. You think in that way only. If he or she is yours, then they will be connected with each other irrespective of whatever happens in your life.
That's words coming out of a true romantic, and that's the most idealistic world.
Yes.
Can I ask you a little bit of a dark question?
Hmm.
I'm sure you must have seen it. I think everybody in the medical colleges, hospitals have seen it. In today's world, cheating on your partner and extramarital affairs. This has become very common in, I think, all around corporate medical fields and everything. What is your opinion about this?
Yeah, I think once the technological advancement has come up, in our age, it was like there was an era without mobile phones. So now it is not like that. The internet, everything is common to everyone. So that kind of extramarital affairs are there. We should accept that. The first thing what I feel is that extramarital affairs is nowadays very common. Don't think that it was not there in the previous time also. It was there every time. But nowadays, it is very easy for everybody to have an extramarital relationship, because I think is the technological advancement. Everybody can talk with anyone with your phones and internet. Everything is there for everyone. And nowadays, these kind of living together, previously when you go to a hotel and all, definitely they'll ask about your all history, and then only you will get. Now it's not like that. It is open for every couples. After 18 years you can decide on that. But my take on the extramarital affairs is like, whenever you feel that your husband is your strength and you are his weakness, then these kind of extramarital affairs will not happen. That is what I feel, and we should be very cautious about it. So once and foremost, we should think that first you select a person, you feel that he is truly loving you, then I never think that these kind of extramarital affairs will ever happen in your life. Most importantly, let him be your strength and you be his weakness.
Golden words, ma'am. Golden words. Ma'am, what would be your relationship advice to our audience here? Best five things that you can suggest to them.
So, in relationship, what I feel is the first thing that you want is trust your partner, irrespective of whoever he is or she is. The second thing is your love should be beyond external beauty. I was not a very beautiful girl while I was with my husband, because I had so many pimples on my face and I was very thin, lean. I was not at all looking good. I was not the best looking girl in my class. So, definitely, the external beauties will not last long. If your love is only based on external beauty, it won't last long. Then the third thing I feel is that heart to heart connection is more important than be physically connected. So as long as that heart to heart connection is there, then this relationship is going to last long. Then the third is a kind of quarrels. It is actually a part and parcel of every relationship. We had quarrels. So when I was late to call him at least for 1 hour, then he'll start bursting at me. So we had enough and more of quarrels in between. But the thing is that your quarrels should not last more than 24 hours, or before sunset you should mend up your quarrels. That is again a part and parcel of every relationship, is what I feel. So I think these are the things that you have to keep in mind whenever you have a relationship with them. other person. Yes.
Thank you so much, ma'am. That was very sweet. And I mean, you are very beautiful. So I think you saying that you are not beautiful is just being plain modest. So let's move on. Ma'am, if we're going to talk about your career now, I've seen that you are a gold medalist in pediatric and palliative medicine. How did you get into that?
So I got gold medal in pediatrics because I was a topper in pediatrics in final year part 2 exam. So that's how I got a pediatrics gold medal. And I was very good in OB-GYN also. But actually I was expecting highest mark in OB-GYN, but because I could get that second position only for OB-GYN. So that's how I was a gold medalist in pediatrics. Palliative medicine is a different story because once I have completed my MBBS, and we had a 5 or 6 years long distance relationship, so we were waiting to be together. So our marriage was just after 2-3 months after my internship we got married. So at that time we had a prefix called as DR, but with no financial backup, and we have to study also because we can't, we have to study at the same time we need some backup, financial backup. So for that matter I tried for a job as a teacher in a medical college which is near my husband's house, but I couldn't get it. They didn't took me. So I wanted to go for a work. He was working in palliative medicine, so I thought why not go with him. So that's the only reason that I go with him during that time and join palliative medicine. So in the palliative medicine there was a national level gold medal exam which is called Bruce Davis gold medal exam. Those time actually was very hard for me because I have to directly deal with the patients most of the time. But still I, in any subject, even if I any subject, to study that subject I was very good at. So there was a good library in Institute of Palliative Medicine, and I did that exam. It was a two parts exam. Part one was an MCQ exam. I got 97 out of 100. And then the second exam was an OSCE exam, which is actually a communication skill, which we were never trained during our MBBS days. So that was a totally different exam for me, but I could crack it well, and that is how I got Bruce Davis gold medal in palliative medicine. Yes, that's the story of that.
Congratulations, ma'am.
Yes.
And let's talk about biochemistry as a career now. Ma'am, biochemistry as a career has a lot of doubts. As you know, NEET PG counseling is going on, I don't know, for like so many months now. So many people have messaged me that biochemistry, now, is that a good career choice to have? Looking at you, a successful biochemist, an educator, and so much more, I think you have proven that even after taking biochemistry, if you are hardworking, if you have the talent and the right strategy and the right vision, you can make biochemistry a great choice.
Yes.
So, ma'am, how would you define biochemistry, and what do you think would be the pros and cons of this particular career branch?
I will tell you some misconceptions about biochemistry. The first thing is that it is just some cycles and enzymes. No, that era has changed. It is not just cycles and enzymes. The second misconcept is, like, if you are working in a lab, the misconcept that everybody is having is that you just load the patient sample into the machine and the machine is going to give you the result. What's the point of an MD biochemist over there? It is not like that. For every parameter that you are checking in biochemistry lab, the first thing that you have to do is a quality control. That is, you have to check whether the value is correct against a known value. If one parameter is out, then the entire like that particular parameter that you are going to do in that same day will not be giving you the correct result. So will the machine change it? No, the machine cannot do anything in that. Then a human brain has to work. You have to find out where it has gone wrong, whether it is a pre-analytical error, the collection or transport. We have to find it out. Many a times critical values will come. We have to directly report to to the clinicians. Sometimes certain values cannot be clinically correlated. Only a clinical biochemist can explain the reason for it. So there is definitely be a need for a clinical biochemist in every lab, in every hospital. So this is not just the machine doing everything. There is a human brain that has to work behind every result that you are getting. It is not only the single result. For example, LFT, it has about 6 or 7 parameters. Each parameters, it has to be done quality check. So that is it. So there is definitely a need for clinical biochemist all over India. But nobody is liking biochemistry, thinking that it is just a preclinical subject like that. But it is not like that. So we have to change our misconception. The third matter, the problem with biochemistry, I will say that in India, we will say the word biochemistry, but nowhere in the world, if you see any medical curriculum, there is no biochemistry anywhere. Then where is it? Is it not a subject? It is a subject. But in other countries, it is known as clinical chemistry or chemical pathology. You won't find biochemistry anywhere outside India. So it is high time that we should change the name of biochemistry to clinical chemistry, chemical pathology, or what we are suggesting is metabolic medicine. So if that name change come, then this biochemistry, considering as just a basic subject, will be over among the medical students. That is one thing which I feel.
Ma'am, apart from the name change, do you think there is any reform required in the curriculum of biochemistry as well?
So in the curriculum, what I feel is that any doctor is should not be trained biochemistry only in its first year. In the first year, they can see biochemistry only as cycles and enzymes. They should be trained in the lab, in just like any paraclinical, that is in the year 2 also, they should have a training in clinical biochemistry lab. Then only they will understand the importance of clinical biochemistry lab. That is one thing which I feel, that one curriculum change that should happen, that clinical biochemistry should be taken to a topic in the second year, and if possible in the final year as well, because every 70 to 80 percentage diagnosis they are going to make with the clinical biochemistry report only. Can you find any single patient without a clinical biochemistry investigation? There is LFT, RFT, which is commonly done for everyone. So definitely they should made, students should be made understand that this biochemistry is not a first year alone subject. It has its application even in the final year till the last breath of every clinician's life, because they have to depend on a result, biochemistry result. So that is what I feel, that there should be some curriculum change also. At the curricular level, there should be change in the when we see biochemistry as a subject. Yes.
Ma'am, let's break another myth. The myth that after doing MD biochemistry, there are very limited options. Ma'am, I would request you to share what are the career growth paths after doing MD biochemistry.
So, MD biochemistry, if you are thinking, the first choice that we all have in our mind is a 9 to 4 job in a medical college. Definitely that is there. So, you should think that that is there open in every college. If you compare MD microbiology, MD pathology, and MD biochemistry, because these are the three lab medicines, now the least saturated one is MD biochemistry only. I'm not sure about the institutes, but all the other colleges, there is even now vacancy as a government job, as an educator in a medical college. The most wanted one is biochemistry. And I should say from my life that I am getting promotions very early as I'm a biochemistry, because cadre promotions, very limited number is there. So when a pathology has to wait for promotion and all, they have to wait for a long time. But biochemistry, they are very less. So I'm getting cadre promotions very fast. So that is one thing. So as a educator in a medical college, definitely that is what everybody is waiting for. Second is in a lab. So in all NABL accredited lab, there should be a clinical biochemist. That is, they are preferring MD biochemistry in a lab. So that is the second option for them. Then NABL accreditation is done by NABL assessors. Who are these NABL assessors? They are the one who has completed biochemistry, pathology, and microbiology. So you can be an NABL assessor, you can be an assessor's trainer of an NABL accreditation, and you can be a trainer's trainer as well. So all these options are there. And also there are options for biochemistry in IITs, because there is a molecular biology and molecular diagnostic level, they are working these IITs. So there are MD biochemistry who is working in IITs also. And moreover, after this, if you want to do a clinical practice, that is also possible, because you can do a DM in genetics, you can do a postdoctoral course in clinical genetics, and there are DM courses available in AIMS Rishikesh for DM metabolic medicine. After that, you are a practitioner, you can do that also. So MD biochemistry is not a dead end branch where you are not going to see steth at all. You can still wear your steth and practice. And I know there are many of my friends who took DM in genetics, and they are practicing as genetic counselors in multinational hospitals. So they are having roaring practice in that. They are much wanted over there. So definitely you can practice also after taking biochemistry. So it is not like other subjects, I should say. There are many options, and you can take a fellowship in Royal College of Pathology, that is for FRCP. That is also possible. After that also, if you want, can get a registration, and you can work abroad also. So there are possibilities after biochemistry. Only thing is that we should find an interest in the subject, and that is what I want to say to every of my PG aspirants here. Biochemistry is not a subject that you think of. It is like that you think of. There are multiple options after taking MD biochemistry. Yes.
Thank you, ma'am. Very well summarized, I would say. Ma'am, you have just mentioned that an MD biochemistry can do DM in genetics, molecular biology, they can do fellowships. Is there any other super specialization available for MD biochemistry?
So as of now, for DM, what is available for MD biochemistry is genetics and metabolic medicine. And lab medicine is also possible. Like previously, DM endocrinology was open to MD biochemistry as well. So I would suggest to the nation and to the policy creators that we are the one also dealing with DM endocrinology. So that should be open for MD biochemistry also. This is my suggestion to the policy makers in the nation.
Out of all these super specialization, which one do you think has the best potential in the upcoming 10 years?
So, if you ask this question, I will say genetics only. Because molecular diagnostic has created a landmark revolution in the entire nation. Because now you have to see a patient not only in bedside. I will say that you should go into the nuclear pore, you should go into the nucleus, and you should see a patient in a molecular level. That era has already come. So I would say that molecular diagnostics is the game changer in the next 10 years. That is how the precision medicine or the patient tailored medicine can be practiced. That is the future.
True, true, true. Absolutely. I totally agree with that. The way things are moving on, I've I've looked up so much research on precision medicine that while you're reading, your mind is blown. That
Yes.
where our the where our world is actually moving on to, the level of precision we are moving on to is just amazing.
Yeah. Which drug, which patient is going to respond can be determined only by a pharmacogenomics and molecular level studies.
And like in
Yes.
10 years, what they are saying, they are predicting is, and you can try to put this in chat GPT as well, that they are predicting that in 10 years, every person on this earth, in this world, basically will have a different pharmacology based on his complete DNA and RNA.
Yeah, true. That is why we are saying that there is a genome card.
Yes.
So, in the next 10 years, I will say that every patient that is coming to your OPD is carrying this genome card with them. So, if you just put it everything what's going to happen to you, everything is there. So definitely that is the future, no doubt about
Do we consider it a data breach or do we consider it advancement? Now, that's the big question
it.
we have to discuss upon. But I think for a person who's going through something, that can be a real life savior.
Yes.
Ma'am, there is another big apprehension, MSc Biochemistry. Now, people who are taking MD Biochemistry, they have this thing in their mind that these people, the MSc Biochemistry, can actually poach their jobs. Now, what is the big difference between MSc Biochemistry and MD Biochemistry?
So MSc Biochemistry, MSc Medical Biochemistry are there, and also MD Biochemistry is there. So when you compare these two, definitely the clinical skill, the person who is having is somebody who has done MBBS and then who has taken MD Biochemistry, not MSc Medical Biochemistry. That is one thing. But definitely this is a teamwork. We cannot always say that they are not under you, or we cannot or underrate everyone. But still, professionally speaking, don't think that in a personal way. Professionally speaking, in an educator, like in a medical college, to those who are teaching MBBS students, should have a basic minimal qualification of MBBS and should teach the students. But there are various possibilities that an MSc Biochemistry can also work. I'm not even underrating them. So they can work in the lab. So in the technical aspect and all, they are much better than us. I do agree. But the clinical touch and that aspect come, definitely we are one step ahead of them. Even now, MSc Biochemistry is not going to be a threat to MD Biochemistry. The reason I will say that, like in India, now 70 percentage should be MD Biochemistry, 30 percentage is the thing I feel that it is given to MSc Biochemistry also. But that will change if students come and take MD Biochemistry. That is what I say. Every time the NMC is saying that because of paucity or lack of MD Biochemistry, we are forced to take MSc Biochemistry to the medical college. So you take MD Biochemistry and be powerful, so that let MD Biochemistry be there in our country, so that there is no paucity of MD Biochemistry. That will come only if you take MD Biochemistry. There is job opportunities for it. So that is what I want to say. There is no comparison between MD or MSc Biochemistry here, but still, I would suggest that after MBBS, you take MD Biochemistry and come to this field. There are enough and more opportunities for it. The country is waiting for you.
I think after this positive message, our audience was going through this, who were going to have some apprehensions about MD biochemistry, I think that's very much cleared. So I guess, guys, if you are motivated by ma'am, please go ahead, think about choosing MD biochemistry, because she has given you a very well summarized career opportunities about this branch. Ma'am, what do you think? What kind of student? The student must be having some traits, right? So, what traits should be in a student so that he or she is well suitable for biochemistry?
So, what I feel is that there is no specific trait that should be there in any person to take biochemistry, but the passion should be there. So, biochemistry, you should understand in the way that it is. You should change the perspective of biochemistry. Don't think that biochemistry is just a preclinical subject, it's a clinical subject. That's the first thing that every doctor or an MBBS student should have in their mind whenever they want to take biochemistry. Apart from that, there is no they are that is something not demanding a skill set from your hand skills or nothing like that. Only thing is that your perspective about biochemistry should change, and that is the first thing I feel that you should have to take MD Biochemistry. The second is that there is an option for to be an educator in biochemistry. So your passion is towards teaching, then definitely this is one of the branch to you. Then don't think that only teaching. If you are having that analytical skills, then also this is a branch for you. See, there are lots of researchers working in the research field who are developing kits, who are developing, whatever diagnosis that we are doing, it is based on a kit. Who is developing this kit? It is somebody who is having a clinical knowledge. So if you have that analytical skill and the research skill, definitely biochemistry is a branch for you. It is not something which is coming out of one day like that a kit come. No, it won't happen. So we need human brains with medical knowledge into that. So that is also another option after biochemistry. You can develop kit and you can get patent also. So why not waiting? You come.
I mean, you were talking about teaching. You have been a teacher, a very passionate teacher, a renowned educator throughout, the world, I would say. Ma'am, what made you get interested in teaching? Because I've seen my father, I've seen so many teachers. I think teaching is a job where you have to be fully invested. Even if you're at 99.99%, I don't think you can become a successful teacher. So even when we are doing this podcast, my father is actually studying downstairs. Like he's genuinely reading a book and he still reads around, I would say, 4 to 5 hours till date. So I have seen that kind of investment from his side. Now, how did you get that kind of interest in teaching?
So basically, I got an interest in teaching is because, well, while I was a medical student, very complicated concept, I used to make it break into small points from that point itself. So I always love to teach someone. So whenever I was a medical student, I used to teach my friends. First, I'll teach myself. When I am reading, and I will teach myself, and then I'll teach my friends. So that time they could understand even the very complicated things very easily. So you get a smile on their face, right? That is the one which made me into this field, first of all. That too, biochemistry is because when I took this biochemistry, I understand that nobody likes biochemistry. So from that day onwards, I started research. I became a lifelong learner. Even now, I'm learning. As you said, like your father, even now I learn and then only I'll take class. So definitely, as a teacher, the most rewarding thing that you have is the smile on your student once you explain a subject. If I ask you also, you will say that you don't like biochemistry. But when I teach biochemistry, they are understanding the concept of biochemistry. So that is one thing which drives me. Second thing is the wealth. It is not the worldly wealth, I mean, the student wealth. That is there only for an educator. It is not there for anybody else. So this wherever I go, wherever you mean for a family vacation or for an outing or for a conference, anywhere I go, I have my students always there ready to help me. So that is the biggest wealth that drives somebody to be a teacher. That is what I feel. And you will be a lifelong learner. And the next thing is that you can influence certain people. Like you can inspire them to be to the medical field or to your subject. This is also possible for a teacher, not for anybody else. So that is what I feel, and that is what drives me to be your teacher, right?
True, ma'am. I think that smile and a thank you message from a student is the biggest thank you any educator can get. And that's what makes everything interesting.
Yes.
Ma'am, you have been teaching for so long now. You have been an educator and you have mentored students all over India. What's the main difference did you find between education, medical education in North India and South India?
That question is like nowadays, with the advancement in all the technology, I am not finding any difference between north, south, east, or west. The reason being, every teacher, every great teacher is there in the social media available for you. When during my time, if I want to learn from Sakshi ma'am, it was not possible for me. But now it's not like that. I can learn from anybody, especially the great teachers of India or globally even with my phone or it's everything is in your fingertip. So once that has come, that era has come, there is no difference between north, south, east or west is what I feel.
So, ma'am, Residencies, if I talk about that, residencies are right now one of the toughest part in a doctor's journey. It is called toxic, it is called super grueling. The work hours are very, again, I would say, audacious. And when I look at and when I listen to so many stories on Twitter and everything, how the JRs are being treated by the seniors, by the patients, I mean, I must say that it's pathetic. How do you think that a resident should basically go and dwell well in the 3 years of his residency?
So residency period is definitely rigorous. I should accept that. But what my suggestion to them is, you think this residency period as taking care of your own child. The PG preparation period I'll compare to somebody who is like a mother who give birth to the child. So that giving birth to a child is painful. You have undergone that pain, right? Whether it is normal labor or it is emergency CS, you have to take a lot of pain while you have to prepare for your PG. So now once you got it, it's your dream child in your hand. So when you take it, when you take your child in your hand, you never feel the weight of the child. You will feel the love that you have. You are having sleepless nights while you are taking care of your own kid. So this PG dream branch that you got is your dream child. Take this dream branch as your dream child, compare it with that. So you will never feel the pain of the sleepless nights and the toxicity even in the department. If you strive through that, then definitely this is your life, this is your child. So see that residency period as your own dream child, and then you will never feel that pain. You will strive through it and you will get through it. So always believe in yourself, you can do it.
True, ma'am. Very motivating. Ma'am, every doctor goes through a period of happiness, joy, and sadness in their career. There is always a point where you feel the most happiest, most fulfilled. Ma'am, what's the point of being the most happiest in your career?
So I would say that the first day that I got the first copy of my book in my hand was the happiest moment in my career life. So I was never, I was just a village girl. I was just an ordinary girl and just an averager. And I joined a medical college. And after that, I took a subject which nobody likes. But at the same time, I have taken so much pain to write that book. And that's the first book, I think, in India, which is having a different perspective, which has made the subject clinically correlated, that has been accepted widely all over India. And the publishers never thought that a biochemistry book will be successful like any other books in the market. So, definitely, the first copy that I got in my hand, it was like the happiest moment I had in my career. That is it.
I mean, I have a huge respect for you because the name Rebecca James and biochemistry go hand in hand. And I think your book has given you that level of synonym with biochemistry. So I have huge respects for you, ma'am, because you have made biochemistry simple for, I think, the whole country. The whole country thanks you for that. I'll be very very straightforward. No, I mean, it's there's no fake words in that. You have literally made biochemistry easy. Thank you so much for that,
Yes.
ma'am. What would be the most toughest part of your career?
The toughest part of my career is the time that I had to work in palliative medicine. The reason is, it is not like I never liked to work directly with a patient, but I was forced to work there because I didn't get a job as a teacher. So that's the toughest time in my life. It's not for everyone, but it's personally for me. So the toughest time, if you ask me, the time that I was forced to work in palliative medicine. It's because I was never a person who liked to directly deal with the patient, even though I like every subject. Every subject I like. So that is the toughest time in my life, because whenever I deal with the patient, rather than feeling sympathy, I was like an empathizing with the patient. Whatever they are saying, I was taking into my heart, and it was personally lot, in a lot way it was affecting me. I had stress, I had depression, I had irregular periods, and I had two abortions also during the because of that hormonal imbalance while I was working in palliative medicine. So I was forced to do that. That is the toughest time I think I had in my life. Then once I have quit that job, I think that's the I think that is the biggest day in my life, because I never like to be like that. That's it.
Ma'am, you're a survivor. You're a true survivor. Ma'am, my next question would be about work life balance. I think one of the most neglected things amongst the life of a doctor is a simple work life balance. We have been told if you have work life balance, you are going towards the loser side. I think that's the biggest misconception we have. Ma'am, what's your opinion about this? Do doctors deserve a work life balance?
So, work life balance is something that every doctor, not only doctor, every person need a work life balance. So, nobody will create that for you. You have to create it for yourself. So, first prioritize the thing is the most important thing that you should do to have a good work life balance. We can't do everything. We can't be successful in every small aspect. There are some priorities in our life. Give priorities to that, and concentrate more on that. That gives you much better relief and much better time management as well, so that you can have a work life balance. If you ask me this question, do you have a work life balance? Definitely. I'm a very busy person, because at home I have two kids to take care, and then I have to go for work, and again coming back I have to prepare for my video classes, I have to prepare for my book, and also in the college I have lots of work, administration works, and again coming back, household works, like that. There is, truly speaking, no work life balance in anybody's life. But if you love what you do, then naturally that balance will come to you. So if you're working, you love what you do, then definitely you won't feel that pain. So you won't feel that you are working, so you are doing something that you love. So you should not feel that pain. Now if you are practicing as a doctor, my life and other doctors life are different. If you are practicing as a doctor, maybe you have to you have to come for a patient where you are in an emergency situation at home or something, or if you have some other engagements, you have to cut that and you have to come for the patient. You may have to do that, but see the patient smile, but see the patient satisfaction. That will relieve you from the heavily work or heavy loaded work that you are doing. So that is what I want to say, that love what you do and work, that think that you are doing something that you love. That's it.
True, ma'am. And for the last question, ma'am, what would be your advice to a new MBBS first year joinee? How should they study biochemistry so that they can, fall in love with the subject?
To my Festumbi, I call them Festumbi heroes. So, to the Festumbi heroes, I would say that you dedicate some time for biochemistry. Your division should not be like 80% time for anatomy, 15% for physiology, and 5% time for biochemistry. It should not be like that. You spend some time for biochemistry, at least learn what you are taught in the same day, that day itself. So that way, don't leave biochemistry to the last, because then that concept cannot be built. So I would say that you should build your concept, and that's how you have to look into the subject. It's very easy for you, because when you have just completed your chemistry and you have reached here, so biochemistry is not a tough subject for you. But if you are leaving everything for the last moment, then you will never build the concept of biochemistry. And remember, after first year also, this is not a subject that you can close. You have to open it later in your life also. So so think biochemistry as a clinical subject and learn, and I would suggest that everybody should teach biochemistry in such a way. Now the educators, the perspective of educators towards biochemistry has changed a lot, not like previously. So to the educators, what I want to say is that teach biochemistry as if it's a clinical subject. Make the students clinically orient to that. And I think with the new curriculum, the CBME curriculum, the way that you have to learn biochemistry has changed a lot. Previously, it was just cycles. Now, no cycles are asked in the exam. So, definitely, they have to learn with concept. So, this is what I want to tell about biochemistry. Learn biochemistry with concept and with clinical correlation. That's how we can make that a change in that subject, right?
Thank you so much, ma'am. You have been very sweet, but the podcast does not end here. We move on to a rapid fire round. We have got some very interesting questions for you. So, ma'am, we are going to know you in more detail. All right, ma'am, are you ready? There are two very simple rules. You have to be super spontaneous and super truthful.
Yes.
No dishonesty. All right. Ma'am, are you a beach person or a mountain person?
I'm a beach person.
Which is your favorite city in our country?
Favorite city is my hometown.
And that's Kottayam, right?
Yes.
If I say the world,
World, I think I haven't explored much in the world, but till now, what I have explored, I feel Switzerland, Venice.
ma'am, where did you go on your last vacation?
I think to Thailand.
How was it?
It was great.
If you could live in any country, where would that be?
My world is my family. So where my family is, there is where my world is. So wherever in the world I live, unless and until my family is with me, I am very happy there, wherever in the world.
Ma'am, in your, courtship time in your own college, let's suppose the connectivity that is there today would have been there then at that time. What do you think? Would you still want a letter or a WhatsApp message would work?
That's a good question. Definitely, if you ask me, I will say letter. Because letter, you have to say take some pains to write the letter. WhatsApp is easy. So if you take some pains for that, definitely that's a better thing. That the person really loves you.
Did he have spies in his college as well?
No, no. I don't have any connection there, but I have friends over there.
Ah.
So something happened, definitely they'll tell me.
So you had your own spies.
Yeah, in a way.
Okay. What's your comfort food?
My whatever my mother makes.
Still, your favorite dish?
My favorite dish is biryani.
Shopping online or in store? What's your favorite way?
Mostly I do online, but in store is my favorite thing. Yeah.
You can't beat going there, trying a t-shirt and then buying it.
No, no. In store you can feel, you can
Yes,
touch and
actually.
buy. So that is in store is the
Yeah.
best.
Mintra, I mean, you can get clothes in your home and everything, but when you go and buy, it's a different feeling.
Yes, sure.
One superpower you wish you had.
The one superpower, I think, if I was a singer, I wish to be a singer, but I don't think, that if somebody could give me that power, that's the best thing, is what I wanted.
Do you think that moving from Government College Kottayam to Government College Kunnur actually strengthened your relationship with your man? Or do you think that if you had been in Government College Kottayam only for those 6 years, something else could have happened?
I think so. Because of that long distance, we could maintain our relationship. If we were in same college, I think we would have quarreled every single day. So that connection, I think we could maintain because of that long distance.
Thank you so much, ma'am. You have been very sweet, very forthcoming, and I think you have given us a lot of advice on relationships, biochemistry, and so much more. Thank you so much for being a part of the Nachiket Bhatia Show.
Thank you. Thank you so much for the platform that you have given it, where I can speak to my students all over India and I think in the world even. Thank you so much.
I think I can speak on behalf of everyone. We all love you. You have made biochemistry simple and you have made the fear of Krebs cycle go away from all of us. So thank you so much.
Thank you.
And thank you so much, guys, for watching this show. I believe today's was a very interesting aspect to what we normally do: relationships, biochemistry, and so much more things. This has one of the most fabulous podcasts I've ever had. So if you have loved it, do drop a heart sign in the comment section. Who do you want the next guest to be? Again, put it in the comment section. And thank you so much for everything. Your love has made the Nachiket Bhatia Show grow fabulously. Thank you so much. Please do subscribe, like, and share. Thank you so much. God bless you and best of luck.